Hi, I'm Megan.
Hi, I'm Amber.
Hi, I'm Tiffany.
Hi, I'm Denicia.
And we're dental hygiene students at Coastal Carolina Community College.
So today we're going to talk about toothbrushing for a patient who may have difficulty brushing on their own. It's best to try to divide the mouth into 4 equal sections, top and bottom, left to right. And so I'm going to start on the right side, and I want to start at the very back in one section. And I'm just going to go in circular motion, and I'm going to try and do 30 seconds just for this one portion of the mouth. And then for the inside, I'm going to do the same thing and start in the back and work my way to the front. And once that 30 seconds is up, I'm going to switch to the top, start at the back, work my way up to the front, and then get the opposite side. And once that 30 seconds is up, I'm going to switch again, top or bottom, it doesn't matter as long as you start in the back. And work your way to the front. And same thing for the back side of the teeth. And you want to make sure that you do this for 2 minutes. 2 minutes for the whole mouth. And that's it. So the next part I'm going to talk about is different types of toothbrushes. And so if your patient is able to brush their teeth on their own, of course, a regular traditional toothbrush works best. If they are having trouble holding it, you can always add like a bicycle handle or like a little foam handle to kind of give them more grip, like so. Another option, if they can tolerate it, is always a power toothbrush, which I fully recommend. This one has different settings, but you don't have to have all the different settings. This one does, however, tell you when you're brushing too hard. It will light up red when you're brushing too hard, so that's always a good thing, especially for your patients who may not fully understand. Another option for the patients who may not be able to really tolerate toothbrushing is this little guy. It just hugs every tooth surface at once to cut down on the amount of time that the caregiver has to spend brushing the patient's teeth. And that's basically it.
We have 2 types. This one is a little wider and it's got a wider handle for easier grasp for dexterity issues. Then you take the string and you would put it through this hole, and then it runs down the back, and you just twist it around here so it locks in place. Then this one is just a snap-on head that you would snap on, and it's got a long skinny handle like a toothbrush. So we're gonna start with this one. You're gonna start up top, and then you're gonna go to the very back and get the last molar. And then you're gonna pull forward a little bit so you can get the C shaping, and you're gonna seesaw, and then you're gonna come out. Then you're gonna go up in the next area, and you're gonna push and seesaw a little bit, pull forward so you get a C shape, and then push back so you get a C shape on the other surface of the tooth. And then you're gonna continue around all the way to the last molar. Make sure you get the last back molar really good. Then you're gonna go down to the lower arch and make sure you get the very back, and you're gonna go down, you're gonna pull forward, get a nice good C shape going on, seesaw it down, pull it up, and then you're gonna continue all the way around to the last molar over here. And the same sequence happens with this one as well. This one might be easier because it's got the wider handle for them to do for themselves. And then you would just start and do the same sequence.
Okay, so for mouthwash, if a patient can tolerate mouthwash, we will put it in a cup, pour it in their mouth. Okay, so if a patient is able to, they can always do this to switch the mouthwash with their teeth. If they're not able to, they can always gently go back side to side with their head so that the mouthwash can go throughout their mouth. And then we also recommend Mouthwash that is alcohol-free for patients who are on medications that can cause dry mouth or if they're prone to dry mouth. Alcohol-free mouthwash is the way to go.
For your patients that may have any appliances, including dentures, it is important that you have your patient or you take them out at least a couple times a day and then definitely overnight. And that is just to allow the tissues to have some time to kind of heal and give it rest from the appliance sitting on it all day long. So the thing to remember with appliances or the dentures is that they are fragile, and so the number one thing that you can do to make sure that you don't drop them and crack them or break them is while you're getting ready to clean them is fill a sink with some water and then lay a rubber mat or a washcloth down at the bottom of the sink just in case they fall out of the hands, especially if your patient is doing it themselves and they have any dexterity issues. So what you would do is you would either remove it or they would remove it, and then you would want to just give it a rinse to get all the saliva and just any loose debris off. And then you would then want to do an immersion cleansing, and that would be with a container that is made for an appliance or for dentures. It has a lid on it. You would also need to put in one denture cleaner of some sort. So here's a couple examples that got ripped off, but it should say, I think, Polident, excuse me. This one is Efferdent. Just a couple examples of what they are, but it's tabs. It's pretty, I'm sure everybody has seen something like this. But anyways, you would put that into the container with warm water. Be sure not to make it hot water because hot water really can distort the appliance. Just be sure to follow the manufacturer's directions for the appropriate amount of time that the appliance should be left in. Once you've pulled them out from that appropriate amount of time, you do want to go in with a specific denture or appliance brush. It has bristles to do the main cleaning, and then this is for any detail cleaning. This is also great if you have a partial or a protuberator for anybody who has like a cleft palate or lip. You could get into the clasp really good with this part. The great thing about these is that denture brushes are usually have a bigger handle, and that's just typically for a more geriatric hand to hold it. Another thing that you can have on hand, or you would need, is like a poly grip or a Polident. This is the adhesive for the appliances. Just like your patients need to be moved around if they are bedridden, same goes for appliances. If they're left in for a long period of time and not taken out daily, they can actually cause sores and lesions in the mouth. So that is something to be aware of and to maybe look for when you are brushing their teeth or removing their appliances.